One of the recent challenges to the healthcare profession has been to reduce overall costs. One way to reduce cost is to speed up the patient's recovery, which shortens their stay in the hospital. Patients who are immobile often prolong their stay when they develop complications such as pressure sores and joint contractures. Pressure sores afflict 26% of the total bed population in the United States. With over 11 million Americans becoming immobile every year, the need to reduce these complications has become a priority. "23 years of innovation, industry leadership, and superior quality products have made Restorative Care of America one of the world's leading manufacturers of restorative care products. RCAI products are handcrafted in the United States using processes and materials that ensure they will last. Tested in leading teaching hospitals across the country, these prefabricated orthoses are easy to apply and easy to maintain. They are made of heat-moldable thermoplastic which accommodates custom modifications and are available in a variety of models and sizes. The original Lennard multi-Podus system can be used in a variety of ways to prevent or reduce the crippling effects of immobility and improper positioning of the lower extremities. The high flexibility and tensile strength of the MPS prevents or treats heel cord shortening or muscle contracture to restore functional range of motion. The Kydex shell flexes to yield to the contracture, then dynamically returns the foot towards the proper 90-degree relationship with the leg. The positive heel clearance of the MPS eliminates pressure on this bony prominence, enhancing effective treatment of heel pressure sores. The anti-rotator bar is located at the back of the MPS. It can be extended outward to prevent internal or external hip rotation. The toe post keeps tight bed linen off the toes, preventing possible pressure sores. Turning the toe post to the side can effectively prevent discomfort and pressure sores from developing on the sides of the feet. Two multi-Podus systems in conjunction with a spreader bar can be used to achieve and maintain controlled abduction up to 35 degrees. The multi-Podus system was skillfully designed by a certified orthotist and tested by patient care experts. With proper use, the multi-Podus system is a valuable adjunct to your program of restorative care. Before applying the multi-Podus system, prepare it by arranging the Velcro straps out of the way. Flex the patient's knee and lift the lower leg. Allow the weight of the leg to seat the sole of the foot in full contact with the bottom of the splint. With one hand, apply pressure directly over the instep of the ankle. Maintaining pressure on the instep, use the other hand to smooth the anklet and fasten the middle strap to the anklet. This step is extremely important. If you release pressure over the instep before the middle strap is secured, or if the instep strap is not the first strap to be fastened, the patient's foot will not be seated correctly in the splint. After the middle strap has been fastened, release the pressure on the instep. Fasten the calf strap next, and then the two remaining foot straps. The correct order in fastening the straps is the instep strap first, followed by the calf strap, and then the two remaining foot straps. Check the position of the patient's foot. The sole of the foot should be in contact with the bottom of the splint. There should be adequate clearance below the heel and at the back of the heel. If the heel is not properly positioned, remove the splint and try again. Pressure sores may occur at the heel if the splint is incorrectly applied. Check the tightness of all the straps by inserting 1 or 2 fingers under each strap. All straps should be snug, but not tight enough to restrict circulation. The toe post is used to keep tight bed linen off the foot and encourage toe extension. It may be adjusted by loosening the knob on the bottom of the splint. By rotating the toe post to the affected side, the side of the foot and ankle is protected from pressure sores. When the toe post is correctly positioned, retighten the knob. Hip rotation can be limited by adjusting the rotator bar. In cases where controlled abduction of the patient's leg is desired, an optional spreader bar can be used to connect the rotator bars of 2 multi-Podus systems. A removable transfer attachment is supplied with the multi-Podus system. It accommodates stand-up transfer and limited ambulation. Velcro strips are attached to the bottom of the MPS liner and to the transfer attachment for easy application and removal. The transfer attachment assures compliance with infection control standards by eliminating cross-contamination from floor to bed. If the splint becomes soiled, it may be taken apart for washing. The beta pile anklet must be removed from the plastic frame. This is done by removing the toe post and releasing the Velcro fastener at the top of the splint. The anklet can then be slipped off. The anklet may be machine washed in warm water. Always use a mild detergent and never use bleach. After washing, allow to air dry or dry on low tumble cycle. Even though the MPS can be cleaned, it cannot be sterilized. Since there is a risk of cross-contamination, the MPS is intended for single patient use only. The AmbuAssist is recommended for patients in gait training or extended ambulation. The AmbuAssist gets patients walking earlier in the recovery process, leading to a better therapeutic result. The multi-Podus system is available in 4 adult and 2 pediatric sizes. The adult size multi-Podus is now offered with an ortho-wick liner. The MPO 2000 provides the same therapeutic results as the original multi-Podus system with a breathable ortho-wick foam liner that absorbs moisture and perspiration away from the patient's body. We hope you have found this videotape helpful and informative. If you have any questions, call our customer service department at 1-800-627-1595.